What do we know about adverse effects of MDMA that are definitive with real science?
Yeah, it's similar to the other issues that I brought up.
But
Although
it doesn't
you
go to
don't
the
see
same
the
receptors.
no, it doesn't. That's another important point. So ketamine, for example, that we just talked about, works on the NMDA glutamate receptor system, and MDMA, instead of working on the serotonin 2A, like we discussed, the DMT from ayahuasca, the LSD, and the psilocybin, we all think that's mostly working through the serotonin 2A receptor. In the case of MDMA, it actually is going inside of the presynaptic terminal and releasing neurotransmitters, more preferentially serotonin. And we think that the way that that is being triggered, Gould Dolan has written a lot on this. It opens this sort of social reward learning critical window where people are more open to experiences. They feel more calm. They feel able to have emotional states, remember past memories that might not be so pleasant, and be able to sort of work with that material. And that leads to, abilities to relearn, like we're seeing in things like the PTSD clinical trials that have been done so far. So from an adverse effect, it's really just the short term blood pressure and heart rate things. It's a slightly higher with MDMA, but not much. A couple beats per minute more, a couple of millimeters of mercury
Right.
more on blood pressure. It's not extensively more, particularly at the 80 milligram dose that's being studied in the phase 3 trials right now. And yeah, these neurotoxicity issues and things, to me, there's nothing really there in a therapeutic clinical trial. We're not seeing people overheat. We're not seeing people get serotonin toxicity or seizures like we have seen in club environments, because you have all these other factors. People are dehydrated, they're overexerting themselves, their temperatures are rising. So that's where we've seen some bad outcomes in those contexts. But in a therapeutic setting, none of those have been issues thus far in the clinical trials from a physiologic standpoint.
So, when with a little piece of paper that gets printed up that's going to be attached to the bottle of MDMA pills that the doctor is going to prescribe if it happens that way, and you open up that little piece of paper, what's it if it was written right now by you, what would it say about adverse effects? Because those little pieces of paper always have some adverse effects written on them.
Sure. Say dizziness, do not operate heavy equipment or machinery while under the influence. That's the major things that you would warn someone about on a prescription bottle like that.
How seriously do you think we can get the public to take don't drive a vehicle under the influence of these substances, particularly like MDMA?
I hope. I mean, with alcohol and cannabis, people have raised this issue of don't drive while impaired. I think that's going to be an important messaging to get out for people that are self-experimenting with any psychedelic medications. So yeah, all the medications we discussed, I would want to have the window of its duration effects where you're not getting in cars and driving anywhere.
Do you think MDMA leads people to do things perhaps against their better judgment that they wouldn't do ordinarily because of the nature of this particular medicine?
I mean, I think maybe depending on the context of use, you may be more open to suggestion from other people. But I think in general that, um, it's not completely changing your personality, I would say. But I think it does leave people open to being more susceptible to suggestion by people. If you're in that sort of loving state, or, you're not being critical, maybe you're feeling a little drowsy or woozy, with some of the dizziness, maybe you're not making all of the best decisions moment to moment. But I think it's very useful from the context of having more introspection and being
Yes,
able to sort of sit with ideas and have conversations about your emotions. I think
yes.
that's what it's really useful for.
Well, it is. No question. It lowers defenses and makes us feel more compassionate. But I'm wondering also to what extent it makes women more open to predators sexually, for example.
I think that's a real potential risk. I think that's a possible risk depending on the environment and the context of the use.
With MDMA particularly.
Yeah. Well, I think any psychedelics really, but I think MDMA is in that category.